Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 78-year-old mother had 2 cardiac arrests. Are they keep her ventilated and sedated for too long? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy. Help! And this is part 1 of a series of questions from Gary, and they are excerpts from a series of one-on-one phone and email counseling and consulting sessions with me over a 2-month period. Gary and his family went through many challenges while his dad was in intensive care, and I felt very privileged helping Gary and his family through this difficult time in his and his dad's life. So, Gary writes: Hi Patrick, my story question is, I believe, at a high level. My dad is 57 years of age. He's currently on a ventilator in intensive care, and he's in an induced coma since arriving at the hospital almost 4 weeks ago. He was brought in with severe pneumonia. He's now apparently in multi-organ failure. I have so many questions that are not getting answered, and I have so many concerns. Hopefully you can help me. Here are more details. My dad was brought to the emergency room with reports of having difficulties breathing. He had no idea he had a pneumonia until arriving by ambulance. They immediately intubated him, placed him in an induced coma, and transported him to intensive care, where he has been ever since. Initially they got the pneumonia stabilized and a bit better with antibiotics and daily bronchoscopy procedures, and he started to improve, but then his vitals crashed. He became worse, and he was becoming increasingly difficult to ventilate. They had to adjust his ventilator settings several times to get it right, and at one point we were called in as we were told he might not make the night. This was around the 2-week point of him being in ICU. After this happened, they took him for a chest x-ray, and it appeared that he had an enlarged heart, much bigger when he first arrived, and they literally cannot explain why. They called it cardiomyopathy. Things improved after this point in terms of his oxygen saturation and general vital signs. However, he wasn't tolerating the daily feedings via a nasogastric tube through his nose into his stomach, and the pneumonia was not getting any better at all. He was also retaining fluids and became visibly swollen. It's now almost 5 weeks, and I rang the hospital yesterday for an update on things, as I do daily, and I was told things are not great and that he now appears to be in multi-organ failure, mainly with his heart and lungs, but his liver is now also affected. I was told the consultant wants to speak with me and the rest of the family to discuss things, and that the team are at an impasse, but apparently can't meet until next Tuesday. It's Friday as I write this. That's a mixed signal to me. They are saying he's not in a good state, but the consultant cannot meet until next Tuesday. Surely if it's a serious situation they would meet as soon as possible. Whenever I go in to see him, the nurses only give me brief updates like, he's not doing great, or no change. I really feel like I have to pull the words from their mouth to get any sort of information from them. I don't know what to do or what I can do from here. What's going to happen? What questions should I be asking the doctors and the nurses? What exactly could the consultant want to speak with me about? Would there be anything more that they can do to fix the situation? Is there anything that they are not doing that they should be doing? As it seems that all they are doing is keeping him sedated and on a ventilator and nothing more. Why are his organs failing when it was initially only his lungs affected at first? I guess I'm expecting the worst case scenario when I go and speak with a consultant, as in he's going to tell me that they can't do anything more for my dad and that we need to decide if we should continue supporting him. I'm already thinking about it. For me, I would want everything that's possible to be done to help save my dad's life. He's only 57 and always had a healthy lifestyle up to this point. He loves life, and I know he would want everything that's possible done to save him. Also, is there a need for him to be that heavily sedated the way he is? It's been over 4 weeks and he has been sedated since. He doesn't even know what's going on. That's the sad part. The last thing he would remember is being in an ambulance 4 weeks ago. Could there be some way that he could get a tracheostomy and also be conscious? Is this the typical sort of care to expect from ICU and pneumonia now with multi-organ failure? Is this the typical course of treatment, or what is the typical course of treatment? Thank you so very much in advance. I'm hoping this will at least help me understand the situation better and hopefully give me some knowledge as to ask better questions, etc. From sincerely yours, Gary. So before I get into my response to Gary's first email when he first made contact, I need to point out that his dad, in his difficult and life-threatening situation, ended up in a small 3-bed ICU, which turned out to be part of the problem, as they weren't equipped or had the experience to deal with such a complex situation Gary's dad was facing. It's just more context around an already complex and difficult situation, and as a side note, if your loved one is facing a difficult situation in intensive care, you want to ask yourself the question if the intensive care unit has the know-how, the experience and the resources to deal with whatever a critical illness throws their way. If you think about it, a 3-bed ICU will never see as many critically ill and complex patients than a bigger ICU in a metropolitan area. Therefore, my recommendation is to look for warning signs early on if you think an ICU has all the resources, equipment and know-how how to treat, and also how to escalate treatment if warranted. If you are in doubt that your critically ill loved one is in the best possible hands, just contact us at support@intensivecarehotline.com or call on one of the numbers on the top of the website. So here's my response to Gary. Hi Gary, thanks for making contact and thank you for your questions. I also want to thank you for using my one-on-one counseling and consulting service. I'm very sorry to hear what you, your family and your 57-year-old dad are currently going through. Your dad is dealing with a very complex situation, especially with the cardiomyopathy, pneumonia and potential multi-organ failure. I know I can help you, answer all of your questions and guide you in the right direction, especially when it comes to asking all the right questions with the doctors and the nurses. There are 2 things that stand out to me, Gary, and I strongly believe they are part of the dilemma you and your family are facing. Your dad is in a 3-bed ICU, and I strongly feel that they are not capable looking after your dad properly with such a high level of acuity and critical illness. For now, even though the situation sounds difficult and challenging, you need to stay positive. And I'll put a link to an article and video that will help you to stay positive. You have also correctly pointed out that your dad is way too young to be given up on. Therefore, you need to make sure that you can challenge the intensive care team and their negative assumptions. I can help you to do that, and I can help you to find the right treatment and therapy options for your dad. I can also tell you from experience that even though the situation looks pretty grim, that intensive care teams are not the best communicators and don't necessarily communicate straight away and straightforward. Their mainly hidden agenda is not your agenda. Gotta keep that in mind at all times, and therefore they want to remain in charge of the communication, the meaning of the situation, and the outcome. 99% of the families of critically ill patients in intensive care are completely oblivious to this. Therefore, it's good that you are seeking help, and I can guide you in the right direction how you can make informed decisions, get peace of mind, control, power, and influence really, really quickly. I think our first two objectives in this situation are to, number one, get your dad a tracheostomy as quickly as possible. Given that it's been nearly 5 weeks after mechanical ventilation and induced coma with pneumonia, cardiomyopathy, and the potential for multi-organ failure, he needs to be in a position to wake up from the induced coma as quickly as possible. A tracheostomy will enable your dad to get out of the induced coma. I'd say that it's negligent not to do a tracheostomy after 5 weeks in an induced coma in intensive care, and they need to be called out on it. That's why I have been saying to you, after I found out that your dad is in a 3-bed ICU, that they have limited to no experience to deal with such a complex situation with cardiomyopathy, pneumonia, and potential multi-organ failure. I also put in some links and articles for you when a patient in intensive care should have a tracheostomy. So you can check out links below this video in the written version of this blog, and one article and video you should check out is how long should a patient be on a ventilator before having a tracheostomy, and the other article and video is how long can a breathing tube or an endotracheal tube stay in. The next objective we should be looking at, Gary, is in cases of severe cardiomyopathy and poor cardiac output, your dad needs an urgent referral to an experienced cardiologist who might be looking into advanced treatment options such as ECMO or ventricular assist devices, or the next escalation would even be a heart transplant. Leaving your dad in such a complex and difficult situation for 5 weeks without performing a tracheostomy and without referring him on to an experienced cardiologist is again negligent to me. By doing a tracheostomy, they could have reduced or eliminated sedation and therefore improved his hemodynamic status, which would have been vital for your dad whilst battling this cardiomyopathy and the pneumonia. I really hope that helps for now, Gary. We will be going into more detail and what needs to be done on our next call. Thanks from Patrick. So that's the first question that I answered for Gary. Again, keep an eye out over the next few weeks. I will publish more of Gary's questions. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.